Welcome to Voice. I'm Federica Mele, and this is a space for honest human conversations. Just presence and two voices. Let's begin. Hi, Anto. Hi, Antonella.
It's a joy and an incredible opportunity to talk to you, not only from a friendship perspective. We are good friends, isn't it? But
Yeah.
also as professionals. Hi, Federica.
Welcome to Voice, Antonella. So you and I go back a long way, all the way to those days of a hot English summer.
If one can say so,
Of
if it ever
many
exists.
years ago. And from that first moment till today, there are so many things that have shifted and changed in our lives. But I can really say that I'm super proud of what you have done during those years. And we will explain to who is listening to us who you are and what you are doing for the humanity.
Let me just
Um,
say just one comment on this, Federica, if I may. I think that life is a journey. And it keeps on evolving. The journey might change direction, and you might meet new people along the way, but there are those very few rare pearls of friends who are those pillars that support you along the entire journey, and you are one of those. And I think that if we are blessed with this type of relationship, it can add an incredible added value to our life, because no matter how many years we're talking about, we were 14 when we met, huh?
yeah.
Now I'm 51. So you can imagine how many years have been going along the way. But still, to know that this type of friendship exists, and if you are in troubles or in despairs, because life gives also this, not just success, you can pick up the phone and say, "Hey, do you have 5 minutes for me? Can we talk?" That's what makes the difference, I think. And I feel a blessed person. So thanks a lot for being my friend.
You. Oh, grazie. Thank you very much. And all the love back to you. I'm really happy that you are here today with us, with me, but with us. I've always considered your voice full of strength and soul, and now I can say definitely of science as well. So I will briefly introduce Antonella to all of you. Antonella Santuccione Chadha is a renowned medical doctor with the expertise in neuroscience, psychiatry, and precision medicine. She has had many leadership roles in her professional life, in academia, pharmaceutical companies, and in startups, helping so many young scientists to grow and to start amazing careers. Currently, she is full dedicated to scaling up Women's Brain Foundation's activities, and she has been awarded numerous times. She has been listed among the top 100 women in business in Switzerland, and she has received the World Sustainability Award, the Veuve Clicquot Bold Woman Award, and the Women Empowering Award. But the most probably important award was received last year in 2024 when she has been honored with the Katherinenturm project for the scientific contribution that has shaped Swiss history. So this is Antonella, this is my friend, a story, a face that radiates purpose, intelligence, and impact. And I'm very, very happy to interview you, to have a chat with you, a raw conversation with you.
Thank you. Thank you so much, Federica. And yeah, sometimes I wonder, is it really me, that person? But I think it is. So, that's also sometimes where we have to self-reflect who we really are and where life brought us.
Yeah. So, Antonella, I want to ask you first, where are you speaking from today, both geographically and also especially emotionally?
Well, I am located in Switzerland. I can say that, of course, I travel a lot. So, I define myself a bit of a European cosmopolitan. And as you know, I embraced also in my household a different culture. I've married a person of Indian origin. I have two kids that have mixed backgrounds. We live in Switzerland. We speak German, we speak Italian and English at home. So this is
Hi, Anto. Hi, Antonella.
it's a joy and how to say, an incredible opportunity to talk to you, not only from a friendship perspective, we are good friends, isn't it? But
Yeah.
also as professionals. Hi, Federica.
Welcome to Voice, Antonella. So you and I go back a long way, all the way to those days of hot English summer
If one can say so,
of
if it ever
many,
exists.
many years ago. And from that first moment till today, there are so many things that have shifted and changed in our lives. But I can really say that I'm super proud of what you have done during those years. And we will explain to who is listening to us who you are and what you are doing for the humanity.
Let me just
Um,
say just one comment on this, Federica, if I may. I think that life is a journey and it keeps on evolving. The journey might change direction and you might meet new people along the way, but there are those very few rare pearls of friends who are those pillars that support you along the entire journey. And you are one of those. And I think that if we are blessed with this type of relationship, it can add an incredible added value to our life. Because no matter how many years we're talking about, we were 14 when we met, huh?
yeah.
Now I'm 51. So you can imagine how many years have been going along the way. But still, to know that this type of friendship exists, and if you are in troubles or in despairs, because life gives also this, not just success, you can pick up the phone and say, "Hey, do you have 5 minutes for me? Can we talk?" That's what makes the difference, I think. And I feel a blessed person. So thanks a lot for being my friend.
You. Oh, grazie. Thank you very much. And all the love back to you. I'm really happy that you are here today with us, with me, but with us. I've always considered your voice full of strength and soul. And now I can say definitely of science as well. So I will briefly introduce Antonella to all of you. Antonella Santuccione Chadha is a renowned medical doctor with the expertise in neuroscience, psychiatry, and precision medicine. She has had many leadership roles in her professional life, in academia, pharmaceutical companies, and in startups, helping so many young scientists to grow and to start amazing careers. Currently, she is full dedicated to scaling up Women's Brain Foundation's activities, and she has been awarded numerous times. She has been listed among the top 100 women in business in Switzerland, and she has received the World Sustainability Award, the Veuve Clicquot Bold Woman Award, and the Women Empowering Award. But the most probably important award was received last year in 2024 when she has been honored with the Katherinenturm project for the scientific contribution that has shaped Swiss history. So this is Antonella, this is my friend, a story, a face that radiates purpose, intelligence, and impact. And I'm very, very happy to interview you, to have a chat with you, a raw conversation with you.
Thank you so much, Federica. And yeah, sometimes I wonder, is it really me, that person? But I think it is. So, that's also sometimes where we have to self-reflect who we really are and where life brought us.
Yeah. So, Antonella, I want to ask you first, where are you speaking from today, both geographically and also especially emotionally?
Well, I am located in Switzerland. I can say that, of course, I travel a lot. So, I define myself a bit of a European cosmopolitan. And as you know, I embraced also in my household a different culture. I've married a person of Indian origin. I have two kids that have mixed backgrounds. We live in Switzerland. We speak German, we speak Italian and English at home. So this is my geographical, let's say, localization with all the nuances of these different geography cultures coming along. My emotional space, where I am in a blessed position at the moment because I am truly doing what I want to do and what I enjoy to do. It's a bit my legacy to the world before maybe soon, maybe later, retire and go for my plan B, that you know which one it is, but we'll talk maybe about it later. So, I am in charge of the Women's Brain Foundation, fostering sex and gender precision medicine, understanding why men and women differ when about disease progression, symptoms, treatment response, and even side effects to any given treatment. This is what we are doing since 2017. We started as an association. I transformed into a foundation last year. We are under the supervision of the Swiss Authority for Foundations. And that again, it's a journey that started while I was doing other assignments. Now I took off all these hats and I do this full time. I'm also in this role advancing, as you mentioned, startups and innovators, because we believe that women's health, precision medicine, it's tightly bound to innovation. So this is my emotional space. Of course, you spoke about awards. I can say when you were listing those, I was thinking, well, actually, my biggest awards that life has given me are my two kids. And so that's also my emotional space and responsibility because they still have to be grown up as hopefully good adults. So I'm still in the midst of motherhood.
Amazing. So, as you have mentioned, you have had so many roles in your life, but today, which one feels most alive in you?
It is really the understanding of how men and women differ in certain type of brain and mental diseases. So my focus is really the female brain versus the male brain, and understanding why Alzheimer, why multiple sclerosis, depression, anxiety, migraine, they do affect disproportionately women. And we speak about 80% of the affected population. So it's quite a significant number, number more, number less, but that's the range. And not to speak about the caregiving population, that again, it is majority women. So what I'm trying to accomplish is to educate the scientific community, policymakers, drug developers, the lay public, each of us, to the relevance of the female brain capital. This is a new coined term that we have been introducing with the work conducted together with the McKinsey Institute of Health, will be published hopefully in a couple of weeks ahead of now. It will be on a journal belonging to the Nature Publishing Group, Nature Mental Health. And we introduced the concept of the female brain capital, why it is so important to invest in understanding how we function and how we disease and how we need specific intervention, because the female brain has been neglected. Our study showed that out of 1 trillion return of investment by investing in women's research, one fourth goes specifically to the brain. So just to say that the brain, compared to all the other organs we have, which are a multitude, right? It is the most underserved, understudied organ of the women body. And I think this is what we're trying to do. We're trying to prioritize this to make the investors and the scientists and the developers to understand the great potential to benefit, first of all, women's health and women's life, and reduce the sufferance, the fact that women spend most of their life, 25% more than men, in poor health. This is a lot if you think about it, right? I mean, and it starts from early ages. People think, well, it's about when we get older with menopause. No, it's already when we experience menstrual pain, and then all the dysfunctioning that many women encounter, like endometriosis, and then there is the pregnancy and the postpartum, and then there is sleeping problems due to the fact that you are maybe breastfeeding until toddlers learn to sleep. There is so much into our well-being and health. And then disease might even hit, like, multiple sclerosis. It's a disease that starts around the age of 40, or even those rare neurological conditions. They start often in the life of women when they are 20 or 30. And I'm speaking about neuroencephalitis or neuromyelitis optica or myasthenia gravis. These are diseases that reduce the quality of life of women, have a profound impact even on our GDP, because look at the paradox. We basically educate women, we invest in their education, and then at some point they either have to drop out because they become patients, or they have to take care of a relative, a child, or someone that is not doing fine. And that's the big burden that we carry on our shoulder, and nobody speaks about it. If you would remove both, let's say not both, just unpaid caregiving from this planet, the GDP of each single nation will drop down. It means company won't function anymore because people can't go to office. Men can't leave the house. So that's the profound meaning of what we are trying to do.
Amazing. So Women's Brains Foundation is more than a project, is a calling, is your mission. And I want to ask, what's the personal pulse behind this work? If there is, but for sure there is.
Yeah, I told you about being awarded in life. And I think that there are two main reasons as why this whole journey began. And there is always a personal story behind it, and then, of course, a professional one. My personal call to act was when, and I talk about it now because I have been elaborating this loss thanks to a book. I wrote a little book, which was for me very helpful to elaborate the pain and transform the pain. And now I can talk about it. But for 10 years, it was a big taboo for me. But my first pregnancy, I was expecting a baby girl, and this child didn't have the scalp, the head, the bones of the head formed, such as the brain was floating in the amniotic, the liquid. And when I've read the reasons why, of course, I was a scientist, I was a researcher, and I was looking at brains on a daily basis. I was taking care of brain and mental diseases in humans. I was doing research in a lab with mouse brains. So brain and neurons was my daily work obsession, if you know what I mean. And then expecting your highly wanted and wished child, and you find out that that was about the brain. I thought, wait a second, hold on, what's going on? Is this a joke of life? What is life trying to tell me? And when I went to read the reasons why, and I've learned that there was a tendency that showed that more female embryo and fetus would have experienced this kind of neurodevelopmental problem, anencephalia. this is when I became obsessed to understand why there is this vulnerability of the female brain to certain type of diseases. And this includes the one I've mentioned here, the Alzheimer, multiple sclerosis, depression, anxiety, um, migraine, and all these, developmental disorders. Um, and then, of course, that was a call to action. When pain and drama hits your life, there are two ways. Either you transform it into something else or you might perish. And I think I was too stubborn, determined, and maybe even too much in love to give up on my biggest hope of becoming a mother. So, but that's what I've done. I told you I was awarded with two wonderful kids. But this was a reason why I started this independent research organization studying exactly this. Of course, there was also another professional experience, eye-opening, that confirmed my personal research as a researcher to understand why it happened to me and to this child. And the professional reason was that I was working as a regulator for the Swiss Agency for Therapeutic Products Approval, meaning I was in charge with the colleagues, of course, of assessing drugs to be approved for the Swiss market and analyze the efficacy and safety profile of those compounds. And it was quite intriguing and intellectually challenging for me to realize that, often sex and gender characteristics were not carefully considered when about clinical trial inclusion criteria, selection of patients, or in terms of diagnosis, or let's say even clinical endpoints and safety profile of drugs. So this problem was systematically represented from number of patients includes in a trial, whether men or women, but also the scales that we use to measure certain type of treatment. And so when I start to realize that, for instance, in a given clinical trial, let's make an example, a clinical trial that would study a drug for um, migraine, there were not enough patients who were eventually male or female being represented, because in general, you should have a representation of patients that most likely represent the normal distribution of a given disease in the population. That's what good science will say, but this was not often the case. And so I started to ask drug developers, why is that? Or what does it mean for clinical efficacy? What does it mean for safety profile? Why more women have headache versus men who might have more headache, just improvising. I'm making examples out of my mind. I'm not referring to any specific drugs at the moment. This I always got wonderful answers from the other side, because I highly likely had scientists that were even better than me, right, in giving me the satisfactory answer. So, as a regulator, you ask, why do you have more women having headache than men, or the other way around? And the answer was satisfactory. I mean, scientifically very valid, but I thought this is not a solution. It cannot be just one hands being raised as a one regulator around the world that has this. We must create a movement that is aware that this must be considered, and we need to change the way we do things. So we started 2017. We have been pioneering the entire ecosystem of sex and gender precision medicine. We work with regulators, with organizations like WHO, with policymakers, with scientists, with academia, with drug developers, with even investors. We cover the entire spectrum of people moving in the field, above all patients, because we started with the patient voice at the center. That's where we learned. And sooner or later, we're all going to be patients, whether we like it or not, by the way. There are just very few blessed people that might die with 100 without never meeting a doctor. So that's what I'm saying. We started this collective movement that started to publish, to generate scientific evidences, really solid science that was educating the world to this unmet need. And today we finally have organizations like McKinsey, I mentioned it earlier, or Kerning, or pharmaceutical industry, the World Economic Forum. We are part of the Global Women Alliance, right? That start to speak about this, put it on their top agenda, which means we did our job. We pioneered, we educated. Now everybody together we can fix it. And some people say, oh, at the beginning you were on the menu card, now you're on the table. There is this way of saying, which is good because it shows that now we finally, have educated everybody, and collectively we're going to change it, because it's just not one group of people
Yeah.
in the world. You need to have full power machinery we put in place. That's what I've learned also in big pharma, where I worked for several years. If you want to launch something great, you need the muscles to do it. You might have the best medicine, the best treatment in the world. If you fail the launch of your drug because you don't know how to bring it to patients, you won't succeed. And that's the same. If you want to launch precision medicine, sex and gender characteristic for the entire world, specifically women, you cannot do it just with one person. You have to do it cross-functionally and across the globe.
So how many people are working with you on this mission?
Well, I think that we have a very interesting session or mode of working. We are a very small, lean core team, and then we rely on a multitude of affiliated experts and scientists that are scattered across the globe. We also have mode of understanding with many academia, and this goes from United States to Europe, to Australia, to the African continent. We really have a large number of collaborators. And the way we work is that we seed ideas, we seed projects, and then we identify who is going to lead it outside together with the organization. So we retain part of the leadership, but it's also delegating execution of the work to a collaborator. And this is going to lead us to the successful outcome. Again, you can't do it on your own. It's not easy because it means you have to delegate a lot, you have to trust a lot, and sometimes, not often, sometimes you might encounter problems because you don't really know what the person in Brazil or in Florida might be doing in terms of this collaboration on a daily basis. But the secret is also to engage with people who are like-minded, who have a high moral compass, and explain very clearly what you want to accomplish, and everybody goes for the same goal. And I would say that we've been lucky so far in seeding very meaningful and strong collaborations with our partners.
Amazing. Have you already reached this area of the world? For people
No,
that don't know, I'm
no,
in Dubai.
no, no. And we discussed already a few times in the past how to make this happen. We need an army of good willed people. So I really hope that you're going to be one of our general in, for a peaceful expansion. Let's put it this way, of this great content that brings women's health at the forefront, women well-being, women needs at the forefront. And I will be very much delighted to find ambassadors in your part of the world, supporters in your part of the world. Our ambition it is to create the first, actually not, I said something wrong. Our ambition was, and we accomplished, to be as the first sex and gender precision medicine research institute in the world, and to have now affiliates. It will be actually a great accomplishment, because to create an institute in that part of the world versus another one, as we said in Melbourne, we have let's call it kind of an affiliate officially established at the University of Melbourne. That's what we want. We want to. It's also learning from the pharma industry, right? I mean, they have a similar model, right? They have the mother company, and then you have all these affiliates that expand around the world, and that's what we want. We want that women feel empowered to use all what we created here to be exported anywhere else. So if there is anyone who wants to take this box we created with some content and take the box and put it in another territory and fill it with local needs, with a specific
Data.
actor of that part of the world, I'm more than glad to pass statutes, to pass anything that needs to be done legally to accomplish this additional success we want to see.
That you will see 100%. So Anto, finally, you are, as you said, under the spotlight with this mission, with this topic, with this with you and the foundation being the pioneer of the gender precision medicine. What's something that people admire in you, because you are for sure very admired, that actually came from something difficult, tough,
Is it a
being,
question for
yeah,
me?
yeah.
This is a fun. I don't know. I think depends on the person you ask. There might be also people who do not admire me at all. And that's fine.
Of course.
Yeah, I think what can be admired of me? I mean, certainly the fact that I'm stubborn. And I think perseverance, endurance, it's really the key to success. Never give up and just be focused to what you want to accomplish, have a vision. This is something I think that it's a strength I have. It maybe resides also partially in the culture I'm coming from, which is Abruzzo. It's a region in Italy where people are described as strong and kind. And I think that I try to move with strength and kindness as much as I can. I might also have some dark sides, like any one of us has. Yeah, and as I said, I think then it depends on the individual who meets me along the way. Once I was told that I have amazing shoes in New York. So that's what they were.
Because
They were not at all to be admired for an Italian style. I was really like, can one say chapel? No. Okay. So it depends on the high of those who are seeing, right? I mean, I would have never thought that those shoes, which are the most comfortable shoes, by the way, that's certain, would have been something wow. But for other people, it might look that way.
Amazing. So, Antonella, you have helped guide and empower many young scientists, women for the majority. What do you wish someone had told you earlier in your journey?
To me,
Yeah.
hmm, well, I can tell you what I've told to my people working with me. And this was already in my early days when I was doing my postdoctoral fellowship in Hamburg, where I had some PhD students I was mentoring as a senior scientist. And I always said to Vasuda, who, by the way, has now a very prestigious role in India. She's back in the country where she was coming from, or other scientists, just to mention one. By the end of the day, she should have left the lab knowing much more than I knew. That was my answer to
Go.
her and to the others. Like, at the end of the day, when you leave this laboratory where we're doing research and we sacrifice our youth working from 8 in the morning until midnight, and so on Saturday, Sunday, and so on the Christmas holiday or the summer vacation, whatever, you need to know by the end of the day more than I know, as me being your teacher, your mentor, your senior
Mentor.
scientist. And what I wish someone would have told me when I was a young person, well, never for what I was as a young woman, I think never wait as a woman for the right moment to become what you want to become. That could be a distinguished professional or a mother, or because there is never the right time for a woman. Maybe for a man, yes, because they have a different type of biological clock. For us, there will be never the right time to be, as I said, the accomplished professional or the perfect student or the mother, or because we have a biological clock that
Yeah.
evolves all the time, that has also some certain type of deadlines, and maybe you want to become a mother with already 25 or not necessarily with late 30. Someone might told you, wait until you finish your study, wait until you get your first job, wait. There is no, just do what you want to do on that moment. Of course, always again, and this goes back to a teaching I got from my grandfather. You met him, non Antonio. Um, Always go with people who are better than you and learn from them daily. That was also what he taught me. He said, choose your friends or your partners or your uh, mentors, like the best you can find, and learn from them on a daily basis. And that's what I think I like to do. I like to have really talented people around me. I'm never the best among those sitting in a room. Actually, the other way around. I'm there to learn and listen every time.
It's very nice what you have just mentioned about your grandfather's teaching. And in fact, I wanted to ask, um, what did you carry with you from those early days before all the awards, the titles that still lives inside you? This is one thing that you have just said.
To be very frank with you, there is only one thing that all this recognition changed. It's my agenda. So I am much more busy than I used to be. That's a matter of fact. But I'm still that person, and I don't think I will ever change. And I come from an humble setting where I was taught to speak with princesses, with decision makers, but at the same time also with the most humble person you might think of. And I've always learned from anyone, and I still do. I still enjoy. I tremendously enjoy to talk with anyone I meet, uh, independently of the look, the view, the whatever. So I don't think I've changed a lot, and I still carry with me my essence, which is be authentic. I love to be authentic. I love to be myself. I come across sometimes with mistakes I do, or some rare, maybe even strong arguments. Sometimes I'm one of these people who rarely get upset, but when it happens, even with my kids, they better leave the house. No, and I love to be that way. I love to be authentic. Sometimes it's good to let it out.
You
Sometimes,
are.
who we are and accept ourselves. And as I said, not everybody might stick to the journey, but certainly we've left always a strong imprinting on those people who were next to us, hopefully in a good way.
So, has there ever been a moment where who you were becoming surprised even yourself?
Oh, well, I am surprised by the fact that I became a medical doctor, for example. I thought I would have never made it simply because when I've chosen what to study, it was a matter of a personal challenge. I was very indecisive. I didn't know what I wanted to be in life. I knew that I wanted to explore new horizons. I was a very curious mind, and we met actually in a foreign country when we were very, very young. So that's how it started. Also, thanks to your parents, who were the first one who nourished that curiosity among the other teachers. So you see, it's always about the people you meet, those role models, those people who motivates you from the very early beginning onwards, and then it carries on. And so basically, um, that's all. It's about who we meet and how we want to evolve. And when I decided to study medicine, I wanted to have this challenge, and I always said, what can I do? I can do anything. I can become now a medical doctor. I can become an architect. I want to become an engineer. I was at Bocconi for a stage, and at
I
some point I said,
remember.
I want to be the Bocconian lady. So it was really a mess in my mind. But then I said, okay, let's do the most difficult male-oriented discipline, because I was told by everybody, oh, if you want to become a doctor, you're not going to have a family. It's not for a woman. It's a job that doesn't fit. Actually, my first dream was to become a policeman like my dad. And they told me, no, forget it. This is just
It's
for
true.
men. I said, oh, okay. Then I go to the other one that it's mainly male oriented, which was to become a medical doctor. And I have to admit, Federica, I kind of didn't like it. It was 6 years of tremendous sufferance, because while I love the topic and the subjects, the amount of learning by
Yeah,
heart, it was still when practicing medicine was something coming at the end of the 6 years of studies. Now students can do more practical experiences in a ward, see patients. At my time, it was really 6 years of mnemonic, intensive, night and day
effort.
learning. And that was for me what was really I want to get out of it. So I finished as soon as possible. I finished even before it was meant to be because I didn't like it much. And then when I had to decide how to express myself at best, I went through research, which was the creativity side of things. So I decided to become a researcher for a precise reason. So I'm surprised that I made it because that was, I think, the most difficult challenge I gave willingly to myself. So I've done it me on myself. I used to say this was 6 years of studio matto disperatissimo. We are quoting here Giacomo Leopardi, who had this 6 years of. I was feeling that way, I said, "Oh my gosh, I'll become curved." He lost it. I learned at that time that unfortunately he even lost his view because he studied so much. I was thinking I'm going to end up like him. I mean, I think that he wrote beautiful pieces like the Infinito, and I think that's what I carry with him of Giacomo Leopardi. Hopefully, not the curveness, and that's it. I hope I answered.
Yes, you did. Let's talk about the legacy that you are building. I want to ask first, how do you define progress today for science, women, and the entire humanity?
Well, when we started, we called ourselves Women's Brain Project. And there was a strong debate, first of all, whether we should have had the women component in the name. And for me, it was a strong yes, because I was really convinced that that should have been done for women. Of course, maybe it comes from, as I told you, my personal story I share with you, but I was really fond of the women tag in the title. And then it was about project. Project has a beginning and an end. And I really hope that the success will be measured by the fact that speaking about sex and gender, precision medicine, and women's health will become something obsolete in 10 years from now. So for me, it's like the legacy is to close a chapter and then move on. There is another chapter that it's very big, which I will not be able to fix in my life, but I really hope that someone will pick it up on this, which is the ethnicity component. You know, ethnicity and race are two elements that are not studied enough in medicine, in drug discovery, in preclinical and clinical research. What if I tell you that if you look at data from the Food and Drug Administration, counting the numbers of patients worldwide participating in clinical trials, and there are very few representative from Black origin or uh, Asian origin versus Caucasian origin, that is the majority. And we speak about, 80% versus 4%, 12%, and then others. So it's huge. It's like 4% or 12% doesn't even hit statistical significance in a study, if you know what I mean.
Yeah.
So my next hope is that once we solve the problem of women's health, we're going to fix the problem of ethnicity. It's an era where the policy of putting some people first might forget others. And for me, it's not about who is first or who is last. I think instead of saying one nation first or one group of people first, or we should put mankind, womankind first and serve, the entire planet and flourish, because that's all about it. And I think that to do this, we need to also have more female leadership, definitely, more different ethnical type of leadership. We live in a world that is very monopolized by certain groups, and I really hope for a more inclusive planet, where diversity is really top of the value.
Yeah, this is very beautiful. Antonella, the last question. You have given us so many precious informations, hints. But I want to ask you if one sentence from this conversation could echo quietly in someone's heart, what would you want it to be?
Well, be authentic, don't give up. Just endurance and persistency will lead you there one day. get inspired by people who are better than you are. And there are a lot where, the world is plenty of incredible, beautiful minds. And yeah, I think that will be it. I mean, and be joyful. Whatever you do, put the joy. I think there was one moment, the haha moment. I was at the World Economic Forum this winter, and I had the privilege of listening to, Deepak Chopra. I met him he's a medical doctor, he's a colleague. I thought, nevertheless, he was a little bit too philosophical for me. I was never really into what he was saying. Then I met him in person, and he gave 45-minute speech where I was so concentrated as I, rarely am. Um, and he concluded this whole conversation where people were just enchanted in listening with a sentence that really touched my heart and resonated so much with me, because he said the real parameter to measure your success, it's the joy you have in doing what you do. And when he told that, I basically tell the same things to my kids and my family members, my team. If there is no happiness anymore in what you do, just change, because life is too short. Can be desperate in a job position, and there will be always a new opportunity coming across, and you can transform towards another individual. You can do another job. You can change all the time, and that's the beauty of being a human. So again, put the joy, and that should be your parameter to measure your success, how joyful you are in what you do.
Grazie, Antonella. You are such a strong leader, really, and thank you for your voice that matters so much for the life that you have experienced and the job that you are on, the mission you are on. Please tell me, you wanted
I
to
want to
add
tell you one.
something.
Yeah, yes, of course. I mean, I know that the title of this conversation is voice to voice, but I think that this interview came across the way it is because this was heart to heart. And I
Yeah.
want to thank you. I want to thank you
Grazie. Thank you very
because
much, Antonella.
it's how many decades we know each other. It's a long lasting friendship, and this is enriching my life.
Oh, and mine as well. And thank you very much, Antonella, again for
Thanks
your
to you for this.
grace, for your mind, for your brilliance, and for your presence. This was
Thanks to you.
a great pleasure. Thank you,
Thanks to you.
Anto.
Thanks.
Ciao.
Ciao, ciao.
Ciao.